Good morning, Jasmine. Looks like we've got a busy day ahead of us, don't we? How was the retreat yesterday?
Oh, it was phenomenal. They actually had sessions on team building, time management, physician support after patient safety incidences, so it was fun.
Oh, that's good. It's nice that the program's able to build several of those things into the retreat.
I agree.
So first on the agenda for today, though, is a family meeting. It's with our 3-month-old patient's family to discuss some of the poor neurological outcomes we expect with the complicated meningitis. Have you had the opportunity to lead a family meeting before?
I have led a few. I find them quite challenging, actually.
What parts of the meeting do you find particularly challenging?
Sometimes I'm just not sure how to introduce prognosis.
Yeah, I can see how that can be difficult. A phrase that I find helpful sometimes is to ask the family permission to talk about their future with the child's illness. That might be something you want to try.
Sure, I can lead the meeting with that.
Yeah, well, how about we go in together? I'll let you lead the meeting and I will observe, and then after we can sit down and have a conversation with some feedback and coaching around how it went for you.
Okay, that'd be super helpful.
Okay, well, let's go.
All right.
All right, so Jasmine, how do you think that went for you, leading the family meeting?
I actually think it went really well. There were parts where I didn't know what to say, and so that's when I turned to you to fill in the blanks.
Yeah, I can see that there were some areas that were tricky, and I did make some notes as we were going along.
Oh, really? Okay.
But to start, I want to invite you to just share with me what parts you think went well.
So I started with introductions, so I felt that was really good to build rapport. And then I asked the parents what they had been told about the patient's medical condition. And then I also used that phrase you had mentioned at the beginning to introduce the prognosis.
Right, I think, yeah, you did a lot of those things really well. You did a nice job of introducing the family and everyone's role. You nicely broke all the information down into small pieces, and you used non-medical language, so I think all of those pieces were really well done. And I'm glad you found the prognosis phrase useful as well. Talk to me a little bit about the parts that you found challenging.
Well, I did start going through the MRI findings, specifically related to the complications of meningitis, and then how that translates to a poor or unfavorable neurological outcome. And then I felt the need to continue to divulge the MRI findings. But I felt like they didn't understand because they kept probing me to pursue further testing, and I found that frustrating.
Yeah, I can see what you're talking about. I know it's really hard when the family's not aligning with what we're trying to say.
Yeah.
And I did notice you were giving additional details about the MRI at that point in time. Can you share with me what your intent was in sharing those additional details at the time?
Well, I mean, they seemed quite quiet, and so I just felt that giving more information might have been helpful in understanding.
I see. Well, one thing I noticed at that moment when you shared prognosis was how tearful the mother was. What were your thoughts on that observation?
I mean, I noticed she was sad, but I didn't really know what to say or how to intervene at that time.
Do you have any ideas on what you could have said at that moment?
I'm not quite sure, actually.
Yeah, you know, responding to emotion can be very difficult. Patients and their families are often sad and overwhelmed, especially when they hear things about negative prognosis. So some things I found helpful before are, after sharing that kind of information, to just pause and allow the family some time to process what they've heard, to maybe acknowledge that this is difficult, and just let them share how they might be experiencing it. So if you were going to do that, any ideas what kind of phrasing you might use?
Well, I could have acknowledged she was sad and say, oh, I noticed you're sad. It's always difficult to hear information like this. Something like that.
Yeah, I think that could be a really useful phrase to use, actually. Now that we've talked a little bit about how to respond to emotion, is there a goal you might have in mind for leading future family meetings?
Yeah, it actually would be helpful to learn about how to respond to emotions and get more ideas.
And any resources you can think of that might help you do that?
Well, Dr. Sandhu, if you have like articles or online videos I could watch, that could be helpful.
Yeah, I can certainly provide you with some of those resources. And actually this week I'll also make a point of pointing out to you how I'm responding to emotions in patients that we're seeing together.
Sure, it'd be nice to see you lead a few family meetings as well.
Absolutely. Anything you can think of that might get in your way of achieving that goal?
Yeah, I mean, there's so many patients to see and so much to read. I find that I may not have the time.
Yeah, it can be really challenging.
Yeah.
Who are you working with next week, Jasmine?
I'm working with Dr. Peters, so I could notify him that this is one of my goals, and he can be on the lookout when I'm in patient encounters.
Yeah, I think that sounds fantastic. How about ideas for who might be able to help keep you on track with your goals moving forward from here?
Yeah, I'm meeting with my faculty advisor actually next week, so I can inform them that this is one of my goals and they can keep track.
That sounds great. And how do you think you'll know that you've achieved your goal of responding to emotions?
Well, I mean, I can continue to seek feedback from my preceptors and also talk to allied health professionals like social work and nursing to see what their perspective is of my encounters with patients and their families.
Yeah, I think that all sounds fantastic. So thanks for your willingness to talk about your goals with me today.
Thanks,
and for engaging in this conversation. So I will certainly keep working on this with you during our week together.
Okay.
But should we move along and see the next patient?
We shall.
Sounds good.
All right.